President Muhammadu Buhari has met with all federal lawmakers at the banquet hall of the Presidential Villa, Abuja. The lawmakers were led to the event by the President of the Senate, Ahmed Lawan, and the Speaker of the House of Representatives, Femi Gbajabiamila. The notice of the meeting had been conveyed in a letter to the National Assembly received from the State House and read during plenary by the President of the Senate. The Senate had on the 27th of April reached a resolution for the leadership of the National Assembly to schedule a meeting with President Buhari to discuss the issues of insecurity in the country. It is the first time the President is hosting all lawmakers of the National Assembly at the same time, having met with members of the Senate and the House of Representatives separately in the past. This comes after the President expressed his thanks to the Ninth Assembly for the cooperation he has enjoyed, which has enabled his administration achieve a lot in the last 2 years. And hours before that meeting with all the lawmakers, President Muhammadu Buhari received the report of the National Security Summit organized by the National Assembly. Among recommendations in the report is the setting up of zonal commissions in order to help resolve issues peculiar to each zone. Taya Modu compiled this report.
The Speaker leads lawmakers to the Presidential Villa to submit the report of the Security Summit it was pushed to convene, following a drastic rise in insecurity across the country. The President is pleased at the cooperation the 9th National Assembly has given government, something he tried very hard to get from the 8th Assembly for the sake of the country, with limited success. He urges leaders to respect the people so that it becomes a duty for them to pay back to the leadership. The Speaker, Femi Gbajabiamila, is optimistic that implementation of recommendations made in the report will set the country on a sound footing. Among these recommendations is the setting up of zonal commissions to consider the peculiar challenges of every geopolitical zone.
Once implemented, we will go a long way to resolving some of the issues, if not all, some of the issues that pervade our society in terms of security. Zonal commissions in all the zones, like the Northeast Development Commission, we will have the Southwest, we will have the South-South, we will have the Southeast, we will have the Northwest, and that it goes a long way in resolving issues, regional and zonal issues.
The National Assembly is also determined to address the overlapping mandates between the security agencies, which breeds confusion in the line of reporting through the introduction of some bills.
The legislative has about 7 recommendations. The executive recommendations are about 19 in all. There are overlapping mandates, for instance, between the security agencies, which breeds confusion and a line of reporting. And those overlapping mandates will be addressed by the House. We've already introduced bills to that effect, and so on and so forth. There's several recommendations.
In all, the lawmakers believe the report will initiate a process that will ensure security issues across the country are better handled by the executive and legislative arms of government. Tai Amudu, TVC News, Abuja.
To election matters now, the Senate has passed a bill seeking to establish an Electoral Offences Commission that will serve as an active justice system for the prosecution of electoral offenders. The bill, when signed into law, will establish a prosecutorial body that will address electoral offences, arraign and prosecute electoral offenders. Also, the Senate rejected the nomination of President Buhari's media aide, Lauretta Onochie, as Commissioner of the Independent National Electoral Commission. National Assembly correspondent TJ Suadewi reports.
The Nigerian Senate has finally passed a bill seeking to establish a special commission that will arrest and prosecute electoral offenders. The bill, which has suffered years of delay at the National Assembly, was passed after the Senate considered the report of its committee on INEC. The bill intends to strengthen Nigeria's electoral process and also enhance the conduct of free, fair and credible elections.
This is yet again another landmark legislation that this Senate has been able to pass, breaking the jinx and the demons are defeated too here. We believe that this will sanitize our electoral system and process, and we believe that INEC and indeed the state independent electoral commissions will be able to conduct their elections free of violence. Congratulations once again.
In another development, 2 presidential nominees for National Commissioner of the Independent National Electoral Commission did not meet the Senate's requirement for confirmation. Lauretta Onochie's nomination was unanimously rejected by the Senate.
Will the Senate approve the nomination of Lauretta Onochie as a commissioner representing Delta State in the Independent National Electoral Commission? Those in favor say aye. Those against say nay. The nays have it.
Her nomination has generated a lot of public outcry from Nigerians who question her political affiliation with the APC and her perceived loyalty to President Muhammadu Buhari. But the Senate's INEC committee recommended her rejection on grounds of going against the country's federal character principles.
Based on the provision of Section 1413 of 1999 Constitution of the Federal Republic of Nigeria as amended, on federal character principle, as earlier stated, and in order for the committee and the Senate to achieve fairness on other states and political zones in the country, the committee is enabled to recommend Mr. Lauretta Onochie for confirmation as National Electoral Commissioner for the Indian National Electoral Commission.
Another nominee, Sani Muhammad Musa, was stepped down until further legislative action is taken by the committee within 2 weeks. The Senate approves the nomination of 5 other candidates who met all requirements for their confirmation by the Senate.
In the Independent National Electoral Commission, those in favor say aye. Those against say nay. The ayes have it.
TJ Swadiri, TVC News, Abuja.
As the quickly spreading third wave of the COVID-19 pandemic continues to gain momentum across most nations and cities, more than 251,000 new cases have been recorded in the first week of July as it hits harder on the African continent. Concerns on the Delta variant and the timeline for the shipment of vaccines between the end of July and the third quarter of the year formed part of discussions of at the weekly briefing of the National Primary Healthcare Development Agency on the vaccine rollout plan. Kemi Balogun reports.
23 countries on the African continent are grappling with the effects of a raging third wave made worse by the fast-spreading variants. Nigeria's first case of the Delta variant was detected on the 8th of July. Nigeria once again is expecting shipments of vaccines even in the midst of a global shortage.
We have also received communication about the delivery of the following vaccine shipments in the coming weeks. Firstly, 3,924,000 doses of the Oxford AstraZeneca by the end of July or early August 2021 from the COVAX facility. Fourthly, 29,850,000 doses of the Johnson & Johnson COVID-19 vaccine procured by the federal government through the African Union.
I do not wish to sound alarmist by saying that last week, Africa marked the continent's most dire week of COVID-19 pandemic. But we all know that the worst is yet to come, with the third wave continuing to escalate and 15 countries now in resurgence.
All 36 states plus the FCT reported that all vaccine were utilized, and we look forward to the remaining 1.4 million receiving their second dose as soon as is possible.
As the country officially ends up the first phase of its COVID-19 vaccination plan, more than 3.9 million eligible Nigerians have been vaccinated, representing 98% of the little over 4 million doses of the vaccine.
The evidence that we have is that the vaccines protect against severe disease, against hospitalization and mortality. However, even with the vaccination, it is possible to have a mild form of the disease, right? And it is still possible for you to transmit the virus.
The agency says it is putting in place all logistics for storage and distribution, as the federal government has also procured 60 units of the U701 ultra-cold chain equipment for deployment across states. With this more than 40 million vaccines coming into Nigeria, its impact will show greatly in boosting the less than 2% rate of Africans that have been fully vaccinated. Kemi Balogun, TVC News, Abuja.
And still talking COVID-19, the Nigeria Center for Disease Control has reported 154 new cases of COVID-19, taking the country's total number of confirmed cases to 168,867. Lagos recorded the highest number of new cases with 119 new infections, followed by Akwa Ibom with 11 new cases, while Rivers recorded 6 new cases. So far, 164,623 people have been discharged, while 2,125 people have died from COVID-19 complications. Well, Nigeria is witnessing a gradual spike of COVID-19 cases, confirming threat of a third wave in the country. Lagos is already recording higher numbers of new infection, and the death of 2 persons in Oyo State attributed to the Delta variant is also more cause for concern. Health authorities are appealing to Nigerians not to let their guard down, but this appeal may be falling on deaf ears, as many have thrown caution to the wind, perhaps tired of the restriction and the new way of life brought on by the pandemic. But now more than ever is the time to abide by safety measures to keep casualty and infection figures low. Joining me in the studio is medical doctor Ebison Arenyika, and via Skype I have Executive Director, Royal Nursing Consult, Julie Mogbo. Thank you, Dr. Arenyika, for joining us. Julie Mogbo, good morning. Thank you for joining us as well.
Good morning, Veronica.
Now, let me begin with you, Julie. Government is saying that, or Lagos State government has said that we are perhaps inching towards a third wave because of the numbers we see rise as a result of the Delta variant that is in the country. But I wonder what concerns you have with this new development. You know, at some point when we had the first wave and I think the second wave, we had a conversation, especially with regards to how this has affected your colleagues. And I'm wondering what concerns now you're having, seen that this is a more virulent strain with regards to the Delta variant.
Thank you very much, Veronica. I still do have concerns about this third variant, and that is fast rising. Like you rightly said, we had conversations in the past, and we have shared concerns about the state of our healthcare system. There still is a lot of work to do in that regard. Already, the onset of the COVID-19 pandemic opened up to us where our lapses are, the gaps that we have in our healthcare system. Regardless of that, my colleagues, the doctors, the nurses, everyone, frontline workers, had to and are still doing all that they can to see that the virus is contained, working with whatever resources, limited resources that are available. Now, there's been a strain already. They are stressed out, especially as the level of compliance, we're gradually letting our guards down. A number of people are still keeping it up. Kudos to them. But with the compliance level reducing and little improvement on our healthcare infrastructures, the strain is getting too much on the healthcare workers. Their ability to pick up motivation to face this new variant is something that calls for concern.
Let's bring the conversation to the studio, Dr. Arenyika. I wonder if you share the same concern as Julie has expressed with regards to you being on the field, seeing that persons are saying this virus, they are tired, you know, the fatigue already around the country. And I wonder what bogs your mind as we speak with this development that we're seeing.
Okay, well, basically at this point, it's part of human nature to get tired after a while of making attempts of being disciplined. People were forced, the cities were forced under disciplinary measures to curtail the virus. And after a while, there was a kind of relaxation, even from the government, in promoting preventive measures and in promoting the initial steps they were taking.
So government shouldn't have relaxed?
They shouldn't have relaxed, definitely, yes.
Right, okay.
Yeah, because even among some of the government, some people don't still believe in COVID-1 in the first place. How much more COVID, third wave?
Right.
Yeah, so definitely from the very first onset, there should have been no relaxation measures at all.
Right.
Definitely, because initially when the COVID first variant came, there was real grassroots education, and the advertisement was going on continually. And,
awareness and all of it.
Awareness and all that, yeah. But after a while, all of a sudden, it's like even in crowded places, there was no much restriction anymore. There was no much check anymore on restrictions. I'm aware of that. And even among some healthcare workers began to even doubt sometimes if this is a propaganda or it's actually real. Not all of them, but
really?
So it became so much.
But seeing their colleagues haven't died, some of their colleagues haven't died from it. I wonder what the doubts could have been, what brought in doubts?
Well, you choose to believe what you choose to believe.
Right.
Exactly. So sometimes they might just feel, okay, maybe it's just a propaganda, or probably because they've been influenced by other people's opinion. They could, it's not like they would not really believe in it, but they might not really believe the effect it can have on the nation as a whole, basically. So they might end up thinking probably this is just a way of the government. A very, very important news going out there is that it's a way of the government to make money. I'm aware of that. Among the healthcare setting, people talk about it. It's just a way of the government. So even when this alert for the third wave came about, most people are thinking, okay, no, it's because people just want to continue making money from this. But I stand to disagree, because this third wave virus has an origin in India, like we all know, and it's actually much more transmissible. Is present in Nigeria.
2 persons have even died.
Exactly. As a matter of fact, Dr. Olabode Ladipo of Oyo State confirmed some cases some days back in Oyo State, and then in Lagos State, there have been cases with deaths already. This third wave of COVID-19, the Delta variant, is much more transmissible, it's much more infectious, and has poorer outcomes. So definitely, we should be on a check for it. We should be on a check for it much more than ever. Measures to be made to curtail from the grassroots the spread of this third wave.
Maybe by education, help us better understand the symptoms, because according to some reports, it is said that the symptoms that we saw in the first variant is different from the Delta variant. Help us better understand what the symptoms are.
Exactly. So that might even be one of the reasons why people are not believing.
Right.
Exactly, because the symptoms don't usually present, or are not presenting like the initial first variant that came. So, for example, this third wave of the COVID-19 presents with symptoms like headache, sore throat, runny nose, compared to the more common symptoms of loss of smell, fever. So it's not everybody coming with the third wave. We have a fever or have a high temperature when they're being checked. And not everyone will end up having a cough. Yeah, so a patient or a person might just be in the room with you. He's having a headache, he might think, oh, it's regular migraine or regular malaria, but it can actually be a third variant manifesting. The sore throat could be interpreted as a normal upper respiratory tract infection. So all these are things that makes the third wave a bit more different.
That's the Delta variant now.
The Delta variant, yeah, the Delta variant, excuse me, a bit more different than the other variants. So we have to be much more careful of this impending danger.
Even as practitioners, because if, as you see a patient, you may not really understand, because it is based on the complaints that the patient puts across that you would treat the person. But let's come back to you, Julie. As we have seen, I wonder what you hope would change this time around, because at the time we spoke, we talked about the welfare of workers, provision of personal protective equipment, and knowing that this Delta variant is more virulent, and as it presents itself, practitioners have to be more aware of perhaps what it is and take precaution. I wonder what you hope would change this time around, especially with the welfare of health workers.
Thank you, Veronica. What I am hoping would rather be improved upon, because there have been some form of welfare packages from what I gathered given out to healthcare workers. What I'm hoping will be improved upon is the engagement of healthcare workers that are probably not yet employed, because we cannot overlabel those that are currently working. So we need to engage more people so that the workload reduces. That is one. Secondly, yes, we cannot rule out the fact that they need some form of encouragement in terms of welfare packages. So if they're going to give some form of stipends or increase their hazard allowance, that could be done, because it could be frustrating if they go to work and what they get at the end of the day is salaries. And like you rightly said, they are seeing their colleagues dying. It's going to be demotivating if nothing is done about it. I am hoping that they're going to have more sessions, seminars, workshops, empowering them, motivating them, letting them understand these, because even the World Health Organization are still trying to understand this Delta variant. So the healthcare workers need to undergo some kind of training, periodic training, consistent training, so they get to understand the symptoms and how to differentiate this from regular illnesses that people encounter. That is on the part of the professionals. Let's go also to the people, because if they do not understand, they're going to keep stressing out, like the World Health Organization says, they will keep stressing an already fragile healthcare system. So we need to also look at the people. Looking at the people, we're talking about advocacy, we're talking about awareness. They need to understand this. And like Dr. Ibusa rightly said, that the people, is just normal for them to relax. And the government was not supposed to relax at all. But seeing that the level of compliance is drastically reducing, we need to pick up speed. We need to get into the environment. We need to get into the society, into the community where we find people. We need to step up the advocacy programs that we are having, whether it's in religious homes or in schools. Thankfully, schools will soon be going on holidays. Most schools will be going on holidays very soon. So it might make the work a lot easier, because they are probably going to be at home. But there needs to be an increase in their awareness, because people are losing faith. And then trust in the government. Government needs to do a lot. We need to see information on the airwaves, on radio, on television, talking about this. We need to know what they are doing to see that we are able to contain this spread. We need to also look at the communities, because one of the things that has to do with this Delta variant, we need to look at the communities that are being vaccinated, because people are at higher risk, especially those that have not received any form of vaccines. If we have people that have been poorly vaccinated in a particular area, the tendency of spreading it is higher as against those that are poorly vaccinated but surrounded by a community of people that are highly vaccinated. So there's a lot of strategy meetings need to be ongoing at this moment, is what I'm expecting would improve. We need to call more people to the stakeholders table. We need to start discussing or continue discussion on how we can keep this under wraps.
Right. Now, still talking about vaccination, Dr. Arinka, Nigeria is expecting 4 shipments of vaccine, according to the reports we heard earlier. Oxford, 3.9 million, Oxford AstraZeneca through the COVAX program, and then 29 million Johnson & Johnson vaccine. But from the report we got in Lagos, the governor was saying that out of the number of persons that have been vaccinated, just 1% out of 60% that we're looking forward to have that herd immunity. Now that we are expecting, how can we ramp up? How can we see that there's a lot of vaccine hesitancy and all of it? We've seen misinformation across the board. How do we change all of this narrative as we are expecting the shipment so that we can get that herd immunity that we are looking forward to? Okay, so now you've mentioned that. So this vaccination is one of the measures we can use to prevent this third wave. Absolutely. Definitely, and so more grassroots awareness has to be made, even amongst right from the healthcare workers, the government officials. Even there are some government officials that have not been vaccinated. Yeah, there are some leaders that have not been vaccinated. And there's this scare. I mean, I was looking at these statistics: 3.9 million out of 120 million. That's poor. That's really poor. So definitely, this vaccine that has been shipped recently has to be pushed out. We don't have to wait for it being dispersed. At the hospital where I work, recently they just ended up the second doses, and for those that didn't receive the first dose, they give us the first dose. So now they have no vaccinations. So we don't have to wait for the vaccines to be dispelled to the different health centers and hospitals before we begin to make awareness of the need for people to get vaccinated. There was not much awareness made. It was more of street talk, and one or two times, a couple of times of advert on the vaccine. But we have to make more grassroots awareness of the need for the vaccination. Because, for example, I have taken my 2 doses of the COVID-19 vaccine. I'm alive. Some people said you would. Did you get that thing that you saw those videos where some person say if they put something, there's a magnet and all? Did you try it out? Did it work out? No, I didn't do that. I just felt probably fever, some body pain for the first dose. The next day, but after the second dose, I felt no symptoms at all. So so definitely this vaccine arrangements and the plans for the vaccination needs to be really pushed out, and we can make use of the other sector of the economy, the musicians, the entertainers, to influence this vaccination drive. Yes. Okay, let me take the same question to Julie. Julie, we're talking vaccination and we're looking to have herd immunity, but then we have the challenge of vaccine hesitancy. A lot of persons, the videos we see online, a lot of people are hesitant to, take the vaccine. And now we are expecting 4 shipments. What should government be doing at this time before the vaccine comes, like Dr. Onochie has said?
Yes, exactly. I think that is the first thing that the government should do, to engage influencers, because beliefs drive behavior. We need to understand that. The sooner we accept it, the better for us. Beliefs drive behavior. And how does belief come? It comes from things that we hear, especially when it comes from people we have high regard for. So if people send information via WhatsApp and they are unverified, we need to let people understand that you cannot take hook, line, and sinker information that is not verified. What are the organizations that we need where we can get authentic information from? These are the things that the government should put forward. Whatever it is, I know they have been doing it. We received status updates on WhatsApp, on Facebook, and all that, but we need to keep pressing. We cannot relax at all. So it's like a battle against myth. It's a strong one. Believes it's a critical deal. So if where people are sending, and authorities have said that what has it that it takes less than 60 seconds for a video to go around 4 times. Less than 60 seconds. So if that is the case, you can imagine how far myths travel. So the government need to up their game to beat win this race. So we need to have awareness information in different forms. We have seen a lot. I really must commend them. I've seen information in Hausa and different languages. We have that, but we need to keep it going back to back. We need to spread this and encourage people to do the same. Let's get influencers. Let's talk to religious leaders. These are the people these are the key people, the influencers that followers listen to. So let's get them up. I keep saying one thing when we're talking about fighting the pandemic of this magnitude, we cannot shut our borders to stakeholders. Let's spread our wings. Let's look for the people that we can bring together, open up discussions. How best can we address this? Like I said, beliefs drive behavior. And having that understanding, we would look at people that can influence people's behavior, that can influence their beliefs, and engage them in driving the, increasing the compliance to this, because they have, of course, hesitance in getting vaccinated. And for those who have been vaccinated as well, I mean, they can come up and speak about it.
Yeah, right. So still staying with you, Julie, because we're wrapping up now, your final word to Nigerians, especially as it is now that it is important for them to take responsibility for their health. What's your final word?
I will say that Nigerians should seek verified information. Whatever it is they find on social media, they need to pass it, run it by their medical doctor, maybe a friend or a family, a relative. Just get verified information. When people send things to you, ask them, what is your source? If it is not verified, I'm not taking it.
All right. Dr. Arenka, your final word.
Okay, so we should go back to the ABCs of COVID-19 prevention. The initial one we had last year, we should maintain it. Social distancing, preventing being involved in confined spaces, hand washing, sanitizer, and yeah, we should do fine with that. So everyone should go back to the ABCs of the prevention.
All right. Thank you so much, Medical Doctor, General Practitioner Ebisan Arenka, and Executive Director, Royal Nursing Consult, Julie Mugbo. Thank you so much for your time on the program.
Thank you.